Chaplain John Deere.
Thank you, Chairman Carter. We appreciate that. Would you bow your heads with me for the invocation? Lord our God, how grateful we are for the joys of this holiday season and the refreshing, brisk air, the twinkling of lights, and the gathering of families and friends brings warmth to our hearts. And whether it is the miracle of provision spoken of in the celebration of Hanukkah, or the gift of the Christ child born in that manger so long ago, we are reminded of the importance of faith and trust in you. So we pause as we open this meeting of our hospital board to express our gratitude and our many thanks for the multiplied blessings of this past year. And we pray for the patients and families who've entrusted themselves to our care. Bless them, we pray, with healing of body and encouragement of spirit as we have the privilege of serving them this holiday season. These things, together we pray. Amen.
Amen.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'd like to call to order the meeting of the Sarasota County Public Hospital Board, and I'll start by reading our statement. Any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. If the citizen comment pertains to an item on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard towards the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments on or discuss or negotiate claims at this meeting. Our first item on the agenda today is approval of the orders of the day, and I think we have changes to the orders of the day, Mr. Strasser.
I have a motion, Mr. Chairman. I move to change the orders of the day to add a motion to ratify the board committee assignments to item 13, board reports.
We have a motion and a second. Any comments? All those in favor of the motion, please indicate by saying yes.
Yes. I think I have another motion, Mr. Well, we'll finish this one then.
Those opposed? Motion passes. Thank you.
Mr. Chairman, I move to change the orders of the day to remove item 14C, period 4.
We have a motion?
So moved. Yes.
And second? Any other questions, comments? If not, all those in favor of the motion indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you very much. All right, our next item is the community...
Approval of the minutes.
Oh,
The orders of the day.
orders of the day, you're right. We need a motion for approval of the minutes of the meeting of September 16th.
So moved.
We have a motion and a second. If there are no comments, the minutes are approved as written. Now, the community medical clinic update. No?
You need to
Oh, okay. Ask for an approval of the amended orders of the day.
So moved.
Okay. Any comments? If not, all those in favor of the motion, please say yes.
Yes.
Those opposed? Motion passes. Thank you. Community medical clinic update. Dr. Wiseman and Kathy Cantley.
Good afternoon. Thanks for having us.
Good afternoon.
So just to refresh your memory, our location is at 1851 Arlington. And if you look at a campus map here over to the left or west, about 2/3 of the way down, there's Arlington Street near the corner of Osprey. We're on the second floor. So our mission is to provide free specialty services to the uninsured and underinsured residents of Sarasota County, and that's how you qualify. You have to live in Sarasota County, and your income has to be at or below 200% of the federal poverty guidelines. And this is what they look like for 2015. An individual, for example, can't make more than $11.32 an hour. Dr. Wiseman and I report to Dr. Steve Taylor, and we have a small, dedicated clinical and administrative staff. Our referrals come from the community primary care providers. About 50% of our referrals come from the Sarasota County Health Department, both here in Sarasota and in Northport. The newest primary care provider, if you go down, is the Good Samaritan. They just started a free clinic this year on Wednesday evenings. We currently have 17 volunteer specialty providers in the walls of our clinic. 13 are retired, 4 are in active practice, and we have over 100 physicians in the community who take our patients in their offices. They all operate with a volunteer provider agreement that gives them sovereign immunity for seeing patients pro bono. On the left, you'll see the physicians who actually come to the clinic, their specialties, and on the right are the physicians out in their offices and the services of the healthcare system that are provided to our patients. Our patient volume pretty much mimics the economy, and you can see between 2006 and 2011, we increased our population by 40%. It's leveling off now as the economy is improving, and this year we're on track to see about a little over 4,600 patients. We contribute to the health of the community by increasing quality and years of healthy life and eliminate health disparities based on income, race, and ethnicity. One of our challenges right now is our space. We only have 3 exam rooms. Our lobby is not accessible directly to the restrooms. We have to let each patient in, and it can be overcrowded, as you can see here, when we have a busy day. I'm going to let Dr. Wiseman take over now, and then we have a short movie.
Hi, Rick Wise is my name. I've been at the Community Medical Clinic for, I don't know how many years, several years, but just say several years. Many years. On the slide, just to update you on our status for the physicians, of our physicians, we have needs in rheumatology, nephrology, and gynecology. And we have areas that are underrepresented, and the most obvious one to me is ophthalmology. And I put on there, or actually Catherine put on there, we have over 20 ophthalmologists in the community. We have 2 or 3 that volunteer their time. And when areas are underrepresented, what happens, of course, is those physicians get sort of deluged and they can burn out pretty quickly. So when you're seeing your eye doctor, put in a plug for the Community Medical Clinic. I appreciate that. We have 2 physicians leaving this year, Dr. Lisa Chmielewski in cardiology and Dr. Marvin Lederman. I just want to say we really appreciate all the time and energy and effort they have given to the clinic, and so thankful for that. This year, we have some new physicians that have joined us. Just recently, Dr. Iron Pober, who actually worked in my group and is retired from active practice and is now working in the clinic, so we're very thankful for that because that was a big area of deficit. Dr. Fred Icharaldi, which is, of course, an active practitioner in the community who has wonderful expertise, who's certainly added to our cardiology resources at the clinic, and then Dr. Alan Lewis, who for many years worked here at Memorial as an orthopedic surgeon, so thankful for that. Many years ago, when I was working at the clinic in a different capacity as a primary care practitioner trying to help the clinic, I came upon this on the bulletin board in the hallways of the clinic. For those of you who may remember, we were actually on the first floor of the real hospital, and this was on the bulletin board, and I wanted to read it. An individual's problem becomes a family's problem. A family's problem becomes a community's problem. A community's problem develops into society's problem. Society's problems become a nation's burden. The community medical clinic serves the nation one individual at a time. Recently, one of those individuals literally came knocking at our door. In fact, it was just this past Wednesday. Catherine and I were going over referrals, and there was a knock at the door. And a gentleman, the door was open, Catherine opened the door, and the gentleman stood there looking older than his stated age, as many of our patients do. And he said, "You probably don't remember me, but about 5 years ago, I had a cancer on my lip. And you helped me, and you basically got me in to see a surgeon, and he took care of it." And he handed Catherine $100. And frankly, he looked like he could he needed the $100 himself, but he had wanted to do this, and he made a special effort to come to the clinic and present that to Catherine. So what he may or may not realize is that there's a lot that goes on behind doors that he doesn't know about, but the basic thing is that we are supported by this board, and we are supported by the administration of this hospital, and wonderful volunteers, physicians who volunteer their time. When I was walking over here, there's a lot of little billboards or little places about the interfaces of this hospital with this community, and that includes our skilled nursing facility out on Rand and Health Fit and all those urgent care facilities, our Cape Surgical Center, and all these things. I didn't see our clinic up on those signs, but it's okay. This hospital can be proud, not in a boastful way, but in a warm way, knowing that we care about those who are less fortunate. And I'm very thankful for you as a board and this administration who supports us, and again, those wonderful physicians that volunteer their time. So thank you.
Thank you.
Hi, my name is Catherine Cantley. I'm the manager of the Community Medical Clinic here at Sarasota Memorial Healthcare Systems. The mission of the community clinic is to provide subspecialty services for those patients in Sarasota County who truly demonstrate a financial need. We work in conjunction with the Sarasota County Health Department and other primary care facilities who refer patients here.
I think that one of our purposes here in the community clinic is we see a lot of patients, unfortunately, in a relatively short period of time, and I think our responsibility is often to make sure that we're not missing any underlying conditions which we can have a positive intervention in.
So that people literally would fall in between the cracks of society. Sometimes they're looking for work, and sometimes they used to have work, but whatever the reason is, they don't have it now. And that's what we're stepping
important because I'm in my mid-50s and, you know, things are starting to happen, and this way at least I can get some medical care. So I appreciate that.
For years, I've been had problems with disability, discovered cervical spine problems. I've never had these problems in my life. Always been fit and able to do anything. I could never imagine that someone would be in a position like this, but to not have the money or the way to get medical care. They've just helped me a whole lot. I don't know what else I would do. Perhaps I'd just be at home, still laying in bed, not able to do anything, wishing I could do better, or for that matter, even getting worse.
Most of them are upbeat, even though they are in a situation where they may be facing foreclosure or they've lost their business. Basically, they're almost homeless. A lot of them are homeless, and they're so happy that we can provide just a little bit of a service in terms of trying to help them health-wise.
I just wanted to say that everyone here in this whole hospital, they are the most understanding, wonderful, nice people and try to go out of their way to help somebody. And I've never seen anywhere any better, with more knowledge and compassion.
Okay. Very nice. Thank you, Catherine, and Dr. Wiseman, very much for what you do. We appreciate it. Thank you. Our next item is the Excel winner. David?
Thank you, Mr. Chairman. I am happy today to get to announce our December 2015 Excel Award winner is Corey Wethington. Corey, come on up. Standing by me?
No.
It helps me.
Okay.
So the Excel recipient for the month of December is Corey, as we just said. Corey is an information systems analyst in physician IT services. She's been an employee of SMH since January of 2009. Corey joined the physician IT services department as a junior analyst, and in a short time she developed expertise with regulatory reporting requirements, staff and provider training and support, and system analysis. She was promoted to information systems analyst and continues to impress. So here's a couple comments from your peers. Working with Corey, I find her to be dependable, efficient, and unfailingly punctual. In fact, I've never worked with a person who gives as much attention to detail as she does. Her willingness to take on difficult projects such as ICD-10 and meaningful use has repeatedly impressed me. Corey is very bright. She has been invaluable to our ICD-10 implementation meetings. She has great knowledge about the inner workings of the EHR, physician flow, and how to approach different personalities with changes. She augments knowledge by doing her homework before meetings and coming very prepared. Corey's funny. You gonna tell a joke in a minute? Okay, all right. She keeps interactions fun, which makes the work environment better. Her mood in our meetings is great with humor. Corey is currently working on the completion of her bachelor's degree in information technology. Congratulations.
Corey, we have a little something here for you. It's the Excel Award. Excel recipients are employees who are models of excellence and consistently demonstrate the mission, vision, and value of our organization. They are superior performers that make an extra effort in the quality and care of our patients and families in the community. The Hospital Board and Administration staff of Sarasota Memorial Healthcare System recognizes Corey with the Excellence Award, the Excel Award for the month of December 2015. Thank you for your continued dedication to excellence. It's signed by David Veringer, President and CEO, and Gregory Carter, Chair of the Sarasota County Public Hospital Board. Congratulations. Well deserved.
I just want to say thank you to everybody. Thank you to my coworkers and my team for thinking of me. And this is really a big honor. Thank you all. Have a nice holiday.
Corey would like to give you a parting gift too today. Okay, but do you mind if I keep this because we want to recognize you at Management Council as well?
I don't mind.
Is that okay? All right. Thank you so much.
Congratulations, Corey. Next, we have Hero Award.
So, Andy and Barry, y'all want to come on up? Come on, guys. Stand over here so you can get in the frame. Don't crowd me, man. So today we have our Hero Award for December 2015. We have Andy Bodon here and Barry Chevalier. Recently, a call over two-way radio indicated that one of our contractors had collapsed on the hospital campus. Andy and Barry arrived to find the individual unconscious on the floor. Andy radioed to call 911 while Barry checked the pulse and breathing. Andy and Barry then started CPR on the individual until the paramedics arrived. Paramedics went on to stabilize the patient and brought him into our emergency room, our ER. Thanks to both Andy and Barry's quick response and actions, this individual is still alive and with us today. So thank you very much, gentlemen.
Well, I'm always proud to provide this award. That means that someone else in the community is still with us today based on your efforts. So if you don't mind, I'm going to read one of these, but provide it to both of you. The Hospital Board, Hero Hall of Fame, Hospital Board and administrative staff of the Sarasota Memorial Healthcare System hereby inducts Barry and Andy into the Team SMH Hero Hall of Fame for actions that captured the essence of true heroes, including courage, to have the persistency in the face of fear, passion, to always do the right thing, integrity, to have a strong and moral compass, and concern, to have concern for the well-being of others. And it's signed today by David Veringer, President and CEO, and the Chair of the Sarasota County Public Hospital Board, Greg Carter. So, Barry? I knew I'd get it wrong. Congratulations, Andy. Well done, both of you.
Thank you so much.
Come on, guys. You got to give a speech.
Well, I'm just thankful that he survived, and I'm really thankful I had Barry with me.
Regardless of what our two individual parts were in this and how wonderful it is to be recognized at this gathering, it's really nice to know that Tim Bowers, the gentleman that we revived, is back at work. So he not only survived, he is at a full pace in his life. So that's really a win for us personally.
Thank you, guys. Barry, I'm going to take it. If you don't mind, and we'll embarrass you at Management Council. Okay, but look. So what's in there? They don't tell me. So thank you, gentlemen.
Thank you.
All right, happy holiday.
Thank you, gentlemen, very much. Next agenda item is report of the medical staff. Dr. Karen Hamad.
Thank you. Today we have three items on the agenda. The first being approval of the radiology department rules.
I move approval of the radiology department rules as approved by the department and recommended by the medical executive committee.
We have a motion and a second. Any comments or questions? Not all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you.
Next, we have approval of the electronic privilege form template.
I move approval of the electronic privilege form template as recommended by the medical executive committee.
We have a motion and a second. Comments, questions? If not, all those in favor of the motion indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you.
And lastly, we ask for approval of the realignment of quality improvement committees. Specifically, we will be moving the MSQI agendas to both a PPEC, which is the Professional Practice Committee, and to QIPSI, Quality Improvement and Patient Safety Committee.
I move approval of the change in the medical staff organization to create the Professional Practice Committee and the Quality Improvement and Patient Safety Committee to replace the Medical Staff Quality Improvement Committee as recommended by the Medical Executive Committee.
Second.
We have a motion and a second. Any questions or comments? If not, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you very much. Auxiliary report, Mr. Ed Miller, Auxiliary President.
Thank you, Mr. Chairman. My report is as follows. This past month, the auxiliary was pleased to stage a very special sale, one of the 5 we stage each year. This vendor, HCI, provides a variety of quality merchandise at attractive prices. It advertises its goods on the flyer as a $6 sale. There are also goods at higher prices. We brought them in at this time of the year so our hospital staff could conveniently purchase items for children, colleagues, and neighbors, for example. The large selection of goods at these moderate prices made the sale a success for our program, which funds scholarships, as you know, and provided a convenient place and time to shop for the season. After a brief rest for our shoppers, we are scheduling another very popular vendor by the name of Scrubs and Stuff for March 15th and 16th of the upcoming year. They sell quality hospital garb, scrub tops, pants, shoes, devices, and gear used by the nursing staff during their day-to-day activities. This is one of our most popular events, and as a result, we schedule them twice a year. We continue to support capacity management initiatives, including planning and training for the new discharge program. Our training program will include instructing these volunteers in the use of a special phone app that will be used to facilitate our hopefully accelerated discharge time. We are implementing a new plan with teenagers to assist on weekend discharges. This is a time slot that's very difficult to fill with our older volunteer members. This teenage staff, under the guidance of an adult, will also be on hand to serve nibbles and drinks in the new discharge lounge, as well as making the discharge persons as comfortable as possible in this scenic venue. That concludes my report. I thank you.
Thank you very much. Our next item is the Sarasota Memorial Healthcare Foundation report. I don't see Alex, so we won't have a report today. So we'll move to the Secretary's report. Mr. Strasser.
Thank you, Mr. Chairman. The board will meet on January the 5th for a board meeting in the morning, Quality Committee, Finance Committee, and Audit Committee. Please note the next change. On January the night, Tuesday, January the 19th, the board will have his meeting. Not Monday Dr. King's birthday. So the meeting will be on Tuesday the 19th. 1 o'clock board meeting, followed by other hospital morning meetings in the morning. Thank you, Mr. Chairman.
Thank you, Mr. Strasser. Next is Treasurer's report. Joseph DiVirgilio.
I have one item this morning, and that is the approval of bad debt and charity care. And I have a motion. I move approval of the bad debt and charity care for the month ending November 30th, 2015, in the amount of $14,732,000.
We have a motion and a second. Any questions? If not, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you very much. Now we have the operations report. First, Bill Wolchin, our Chief Financial Officer.
Thank you, Mr. Chairman. I have the financial highlights for November and fiscal year to date. November being the second month of our fiscal year, the fiscal year to date numbers are a 2-month total. For November, the system's operating revenue was $53,876,000 compared to a budget of $53,348,000. For the 2 months ended November 30, the operating revenue $109,096,000 compared to a budget of $107,315,000. The expenses for the system for the month of November, $53,174,000 compared to a budget of $52,779,000. Fiscal year to date, total expenses of $107,261,000 compared to a budget of $106,900,000. Our operating income for the system for the month of November, $3,461,000, which generated an operating margin of 6%, compared to $3,304,000, or an operating margin of 5.8%. Fiscal year to date, operating income of $7,346,000, operating margin of 6.3%, compared to a budget of $5,881,000, or operating margin of 5.1%. For hospital statistics, and these are year-to-date numbers, the average daily occupancy, 453 patients, compared to a budget of 438. The average length of stay, 4.66 days. Last year, for the year-to-date at that time, 4.62 days. Admissions, 4,901, compared to a budget of 4,498. Our surgery cases, 3,383, compared to a budget of 3,256. And so far, through 2 months this fiscal year, we've had 566 births, compared to a budget of 633. Hospital's outpatient registrations through 2 months, 68,846, compared to a budget of 67,452. Emergency care center registrations, 19,926, compared to a budget of 17,452. And through 2 months, our case mix index, 1.89 for all patients, and for Medicare patients, 2.02. Mr. Chairman, that concludes my report, unless there's any questions.
No questions? Okay, thank you, Bill. Next is our Chief Nursing Officer, Jan Mock.
Good afternoon. I want to wish each and every one of you Merry Christmas, Happy Holiday, and Great New Year. As you see in this picture, I'd like to first start out with people and recognize Mary O'Connor, who won the Florida Organization of Nurse Executive, which is called FONE, Award for Excellence in Clinical Practice at the November meeting. Mary is the manager of childbirth education and lactation services. And some of the things that she was identified in her award were some of the driving initiatives, rooming in for newborns into their families, exclusive breastfeeding, milk depot, which you've heard about before, and baby-friendly designation. She's a passionate and engaged leader that is always striving for excellence. So please help me congratulate Mary O'Connor if you see her. The next award winner at the FONE conference was Jen Reingans for her research poster. And we encourage nurses to publicly speak, do poster and podium presentations, obviously. Dr. Jen Reingans is our PhD nurse researcher and also is the facilitator for our shared governance or magnet councils. Her research was done in transcendental meditation, and it has to do with compassion fatigue and satisfaction among nurses, as we all know, is something that we all work on, and to have a healthy work environment. The study questions was to evaluate the effectiveness of this meditation, which is a deep meditation technique on nurses' compassion fatigue and resilience. And her study showed that it did improve both compassion fatigue and resilience, and related to overall effectiveness of the program, which was the meditation techniques. And so we want to congratulate Jen Reingans on her award. Next, you will see here, you can see that the demolition of the Ritter building has started. And you can see that they've started on the 4th and 5th floor. And this will be, they will be bringing in the big equipment so that the rest of the building will be coming down probably around January, the 1st of January, 2016. And so keep notice of this and watch the demolition in place. The next thing is the bulldozer is done, and at St. Armand's, the old building is down, and the construction documents are at the city being reviewed, and the completion date for this project is scheduled for October of 2016. And the last is just on the continuity clinic in Newtown. Title work is complete, as well as the appraisal and boundary survey. And in July of 2017 is where readiness for that operation will be. The last thing I would like to share with you is our nursing satisfaction, but I want to brief you just a little bit on our magnet journey. We are working on our 4th magnet designation, which we have 24 months or 2 years left until we submit our application. For the community, magnet designation is the highest and most prestigious credential of a healthcare system can achieve for nursing excellence and quality patient care. This is a performance-driven credential that brings both external prestige, benefits, and a wide range of internal benefits, such as improving safety, nurse satisfaction and retention, reducing costs, and superior patient outcomes. Today, I want to share with you our nursing satisfaction scores, which we completed in October of 2015. And we had to take this survey along with the Gallup because it answers the questions that are required to put in our magnet application. We must outperform the national benchmark in the majority of our nursing departments. So the overall scores you can see here, and we did outperform those in the majority of our departments. So we're very pleased about that. We had 68% of our nurses complete the survey, which is 709, and it's on a 6-point scale. So if you look at autonomy, which addresses that they have input, they can control their work, and they can adjust their work based on patient needs, you can see we outperformed the national benchmark. RN to RN communication, they count on each other, they use teamwork, and they support each other. You can see that we outscored on the benchmark. Nursing administration addresses the satisfaction of the chief nursing officer, that the chief nursing officer has equal authority with the other top hospital executives, and that the chief nursing officer is visible. And I want to thank Greg Carter, who quarterly goes on night rounds with me to visit all the nursing units, and that's a key part of visibility. So thank you, Greg. Under professional development, you can see the scores there, and below you can see where we scored and where the mean is. And this really addresses career development opportunities, allowing them to proceed with nursing degrees, higher nursing degrees, and career development. And the last category is professional development access, which addresses accessibility to regional and national conferences. And if Alex was here, I will recognize her anyway. The foundation is a tremendous support in providing these opportunities to our nurses. So I want to thank Alex and the foundation. And regular in-services and continuing education. We work daily to ensure nurses have a healthy work environment, and we're very proud of these results. Because of these results, it helps us recruit and retain nurses. So just a brief update on the great work that Lori and her team has done is we had a total net hire of 151 nurses as of 12/18, and we will have 171 because they've already been hired by January 4th, which met our goal of 154. And this is our Phase 1 goal, as you remember. And our Phase 2 goal is to have 55 more nurses hired by March. And this provides that our census stays what we had planned, but we all know that our census is above that. So I want to thank the team and all of their work for all of the things that they've done. I do think our magnet designation does help, and that's been proven in the recruitment and retention of quality nurses. Again, thank you, and have a happy and safe holiday. Any questions? Okay.
Good job.
Thank you, Jan, very much. Board reports. Ratification of board committee assignments.
Mr. Chairman, thank you, Mr. Chairman. I move ratification of the board committee assignments as made by the board chair.
Second.
We have a motion and a second. All those in favor indicate by saying yes.
Yes. Yes.
Opposed? Motion passes. Thank you. Our next item is committee reports, and we'll start with the Governance Effectiveness Committee. The Governance Committee met twice this past month to review candidates for board seats in the event that we need them in the future. And that was the content of both of those meetings. The next report is the Human Resource Committee. Joseph DiVirgilio.
Thank you, Mr. Chairman. The Human Resource Committee met on December 1st, 2015. We had one action item on the agenda, and that was Mr. Varinger's, CEO's review. The board discussed the success of the system overall under David's leadership, including the strength of the system's financial management, the successful achievement of provisional trauma status, the achievements related to establishing the residency program with Florida State University, and the continued ability to maintain high patient safety and quality of care scores despite the record volume that we've been experiencing. Based on the committee's discussion, I hereby move to accept the committee's recommendations with regard to Mr. Varinger's review.
Second.
We have a motion and a second. Any comments, questions? If not, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you. Next, we have the Mission and Planning Committee. Dr. Marguerite Malone.
Thank you, Mr. Chairman. The Mission and Planning Committee met on December 1st, and the first item of business was around the ICU gas column replacement. And we got a report on that. It's Phase 3 of the project, and the project scope was to replace 23-year-old medical gas columns and 7 ICU pods and 62 ICU beds, and this is the final phase of it. So the cost is $2,300,000, and that was discussed because there was an increase of $300,000 in order to replace the nurse call system, which is no longer being supported. And the project funding sources include the foundation, who supplied $2.2 million, and the hospital will supply the rest of the funding. So at this time, I move approval of Phase 3 of the replacement of the medical gas columns for a cost not to exceed $2 million as recommended by the Mission and Planning Committee.
Second.
We have a motion and a second. Any questions?
Comment, please.
Yes, Mr. Henry.
Thank you. I'd like to vote my approval of this motion, as long as we add some wording that says how much we appreciate the foundation's assistance.
Thank you, Mr. Yes.
If I may, Mr. Chairman, I'd like to say that we always do appreciate the foundation's assistance to us, and we say it in other ways, and that in this motion itself, I think probably we do not want to do that. We want to stick to the financial support for the project.
Well, I agree. All those in favor of the motion as read,
Yes.
please indicate by saying yes.
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 Opposed?
Opposed.
Thank you. Motion passes. Next.
Our second item of business was the Continuity of Care Clinic in Newtown. And Dr. Wilhelmine Weiss-Romisch, I hope I said that right, presented a report on this continuity clinic to us. And it is going to provide access to internal medicine, that is primary care, to adults in the community in which they live. This, of course, then decreases the use of the emergency care center as a source of primary care. So that's one of the benefits. Additionally, the clinic meets the requirements for our new internal medicine residency program, which we're about to begin. The residency program has applied for accreditation. We anticipate a site visit in January and hope to receive initial approval by April. And Dr. Weiss-Romisch discussed what the resident physicians do, and these are all folks who've completed medical or osteopathic school, so they already have 8 years of education. They all have to meet state licensure requirements, and then those become the physicians that work in this continuity clinic. A group called ACGME is the body that accredits the programs in the U.S., and one of their requirements is that a third of the training for residents has to occur in an ambulatory setting. So the resident physicians become a patient's primary care doctor and follow them for 3 years. So this also will be very good for the folks who live in Newtown. They will have the same physicians for 3 years. So Tom Perigo then discussed the design of the building, the preliminary site planning, requirements, zoning, cost estimates, and David Verender, our CEO, advised that he had been meeting with the city to discuss locations. So at this time, I move approval of funding for purchase and build out of the site of the FSU SMH residency program, internal medicine practice in Newtown, for a cost not to exceed $2,200,000 as recommended by the Mission and Planning Committee.
Second. We have a motion and a second. Any comments or questions? Mr. Henry.
I have listened quite intently to Dr. Malone's explanation of mission. I'm fully supportive of it, but I do not believe it be in the best interest of our financial fiduciary requirements to purchase and build a facility in part of the county which is not sustainable.
Any other comments?
If I may, Mr. Chairman, I
Yes,
believe
please.
we've all discussed in our previous meetings that this seems to be a win-win-win for the community. There's a requirement for our program that there be a continuity clinic. We as a hospital system are always concerned about keeping our costs low, and we certainly as a community hospital are here to provide the best care to everybody in the county. And so to have a community clinic which meets our residency requirement in an area where many of the people don't have access readily to medical care and instead use the more expensive ER service, and then also to have our policy of expanding out near to everybody in the county as much as we can be met, was something that I think we all felt extremely good about and would be of extreme benefit to the community.
Thank you.
Mr.
Any
Chairman,
other comments?
one other
Yes,
comment.
please.
And I was highly supportive of this, and I think two things. One, we had reviewed that the need, primary care need, and the underserved area of that community will be addressed a lot more by this. And secondly, I'm very supportive of us being one to provide, economic development, a new facility, really trying to support the development of an area that needs a lot more support than some of the other areas in the county. So I think this is a wise investment, and it's a long-term commitment. We're not going away. This is going to be something that we're going to be utilizing year after year as new groups of residents come through. So I'm supportive of this resolution.
Other comments? If not, all those in favor of the motion, please indicate by saying yes.
Yes.
All those opposed?
Opposed.
Motion passes. Thank you.
Our next item taken up at our Mission and Planning Committee meeting is the Rehabilitation Pavilion update. Of course, we've been ongoing with that, but we had a brief review of the agenda and scope of our original project, and at that time, we thought 34 licensed beds would suffice us for a while, although our intent was to have up to 54 licensed beds. Well, at this time, we've met the criteria for the statutory formula to go ahead and add 10 more beds now. So that's 44 beds. And we're going to file a CON in December. At the same time, the infrastructure for the remaining 10 beds will be put in the unit. They will not be hooked up, but it will be plumbed and all of that, so that when we meet the statutory requirement for the next 10 beds, we're ready to move. And so the site plan about the scope hasn't changed. And more impressive was that the timing isn't going to change either, even though we're going to put in an additional 10 beds. So that's a nice circumstance. So at this time, I move approval of additional funding in the amount of $3,947,839 to add beds to the Rehabilitation Hospital project, to bring the total project cost to $49,947,839, as recommended by the Mission and Planning Committee.
Second.
We have a motion and a second. Any comments, questions? Yes, Mr. Henry.
We have taken down the Redder building. I have not heard the plans to carry the Redder name into the future. Do we have a plan for that?
Not at this time, no.
Should have one, in my opinion.
This has been discussed at one of the planning meetings for the rehab center with Alex Quarles, the president of the foundation. And this has been taken into consideration, and she and the foundation are good with how we're moving. So she is aware.
Okay.
One last item, Mr. Chairman.
We need to vote on this.
Oh, sorry, yes.
Any other comments? All those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion carries.
Our last quick item was that we had an informational report from our COO, Lori Lang, that the administration has approved the relocation and renovation of the bronchoscopy lab in the amount of $850,000. So we are moving forward on all fronts. And that concludes my report. Thank you.
Thank you, Dr. Malone. One comment before we move on, Mr. Henry. I was just informed that the family has been informed about that Redder building being taken down, so the family is aware also.
Okay.
Thank you for your comment.
Thank you for the knowledge.
Next is the Quality Committee. Dr. Malone?
As the vice chairman of the Quality Committee, I have to say that since it is a meeting held not in the public, I don't have any information to portray at this time.
Thank you very much. Next is the President's report. David Verinder, our President and CEO.
Thank you, Mr. Chairman. So today we are going to take a look at our November report to our results for the board. We're going to start like we always do on our organizational report card. We look at our service pillar in our HCAHPS inpatient indicator of all number of domains at or above the 50th percentile. And we have a goal of hitting 9 out of 11 of those. I'm happy to report that we did exceed the goal this month and are at 10 out of 11. In the outpatient side, we have changed this up from the prior couple of years where we used to measure percent of likelihood of recommending our organization to looking at a much more broad outpatient indicator, which we have 58 different indicators in that now. And we're looking at, and we have a goal of hitting 55 out of those 58 at or above the 50th percentile each and every month. So I'm happy to report that this month we did come in at 56 out of the 58. In the people pillar, this is also something that's changed a little bit from prior months. Before we had looked at our turnover rate, and we had looked at the turnover rate for the entire organization. As we continue to drill down on what's what part is the most costly of turnover, is those that we hire that don't make it for the first 12 months. And so we're going to continue to look at this and try to drive down some performance, or drive up performance in our organization. So we have a goal of being at 34% or lower in this. This month we came in a little higher than that, as we've been a little traditionally higher, and we're at 35.5%. So we look forward to sharing some positive results with the board around that. In the quality pillar, we have the same indicator that we have had for the last year in this infection prevention, which is a combined overall standardized infection rate. Our goal is the same as last year, of being less than 0.95. And I'm happy to report that this month we did come in at 0.92, so a pretty sizable improvement over what we had reported for last year. In the finance pillar, Bill has already reviewed that, and that is simply our operating margin. So our goal, 5.2%, is our annual budget, and right now we're tracking an annual operation margin of 5.4%. In the growth pillar, it's largely the same as what we've had before. The only difference that we've made this year is that we're not only counting inpatient admits, but we're also counting observation patients that are in our house because of CMS designation. We have a goal of being at 35,301 inpatient admits and OBS, and right now we are exceeding that. We're at 37,999. For outpatient registrations, this is calculated the same as it's been in prior years. We have a goal of 747,485, and we are exceeding that at this point at 751,019. So moving on, we'll look a little bit deeper into our HCAHPS reports. As I said, we were at 10 out of 11 for this past month. But when we look at the sheet that's in front of you, in the middle column, reports our October and November data, and as you can see, we've only had a miss on the quietness of hospital environment, but even that improved over the fourth quarter last year. So I want to thank all of our staff for their work on that. Look at the outpatient system report card. You can see when you look into the 58 domains, they're broken up on the left-hand side into 7 different categories. So where we are for the October and November this year, we did hit 56 out of those 58, which is a 97%. And once again, we'll continue to report this each and every month. Moving on to people. We have a lot of these type of things this time of year, so I think it's just really a testament to the staff of our throughout the hospital system and everybody's giving nature. But this particular picture is our annual administrative assistance council party, holiday party, and toy drive to benefit mothers, helping mothers. And again, staff coordinated the holiday toy drives for Mothers Helping Mothers, a local all-volunteer, not-for-profit organization that provides basic necessities free of charge to families in need. So I want to thank all of our AAs there. Next, we have, in addition to that, we have participants that included our HIM department, our supply chain, clinical systems, patient financial services, and First Physicians Group internal medicine program. And once again, you see everyone had drives to do what they were doing, and several of the pictures are here. Since 2012, SMH staff, retired employees, family members, physicians, volunteers, and friends have adopted Children First families for the holiday. Children First is a local nonprofit organization that serves over 600 of Sarasota County's most vulnerable children, birth to 5 years, and their families. This year, Sarasota Memorial adopted 21 of these families, and here's just a couple of pictures representing what goes on. Staying in the people category, we next take a look at the Freedom Awards. Sarasota Memorial was well represented at the Sarasota County NAACP's recent Freedom Awards banquet, with several inductees from the hospital's Black History Month Hall of Fame in attendance, including SMH Hall of Fame inductee Priscilla Diener, guest Francis Lund, and Shirley Baldwin. SMH Hall of Famers Barbara Dixon and Bertie Curry, guest James Curry, SMH RN Carla Rock, and SMH Hall of Famer Carlos Rock. The annual banquet pays special recognition to individuals, organizations, and businesses who make significant contributions to our community. So thank you very much to them. Next, we have a patient story, and I typically don't do this, and so we're in the quality pillar, but this is one where the patient was very happy to share their story with us, and we were able to have them. They asked us if we would share it, and I felt it would be a great story. So on November 8th, UCLA Club triathlete Coach Brady Bryan was hit by a car while competing in a bicycle portion of the Challenge Florida Triathlon in Venice. Unresponsive at the scene, he was brought to SMH as a level 1 trauma alert, which is our most critical. With several injuries, including a head injury, multiple fractures, severe lung contusions, and an injured liver and spleen. After 17 days in our ICU and time on our neurology and comprehensive rehab units, we're happy to share the news on behalf of his family that Brady's doing well and is now out of the hospital recuperating with family. We are very happy for Brady and couldn't be more proud of our entire trauma team for how they acted and took care of this patient. Staying in the quality section, I also want to once again talk to mention that we did receive our DMV certification this past month. It was, as you all know, we've started to be accredited now by not only Joint Commission but also DMV, and this was our first survey, so it went well, got our official certification, and we are accredited now for another 3 years with them. Staying in quality, SMH Public Safety ranked in the top 500 worldwide. So SMH's Public Safety Department has been included in Security Magazine's 2015 Security 500 ranking as one of the 500 best managed security organizations worldwide and across all industries. SMH Public Safety was one of only 30 healthcare-based security organizations to be included in this year's Security 500. This annual report is based on benchmarking data collected worldwide and from all industries and governmental agencies, then tabulated by Security Magazine. It's the second time that SMH Public Safety has made the Security 500 rankings. Last time was during 2010 award year. So congratulations to all of our public safety team, and special thanks for Mickey Watson for his leadership, and Rich. I think, Rich, you're back here. Thank you. And Rich, thank you for everything y'all do. I'll talk just briefly about a couple of upcoming events that we have. We have the 1-week wellness warm-up from January 4th to the 8th. With Health Connections. So we invite the public and employees here to go. Sessions Monday through Friday from 7:30 to 8 o'clock, and then from 12 to 12:30. We also have our Peace in Public Health Forum January 13th, 2016 by our own Chief of Staff, Dr. Karen Hammond. So, Karen, we appreciate you taking your time to put this together, and we know the public will enjoy that. We have our annual Parkinson's Symposium coming up Saturday, January 23rd, out at IFAM at 8:30 registration, 9 to 11:30 is the program. So we invite you to register for that if you would like to attend. And then our very popular annual fourth annual Cardiac Summit, which will be at the hospital on February 13th from 7 a.m. to 3 p.m. Once again, fills up fast, so we'd encourage anyone who wants to be there to RSVP for that as well. In the growth section, we just had a little bit of a discussion about this, but the Newtown residency practice really is something we're very proud of. There's a couple articles that came out on that, and I just want to personally thank the board for your support on this. I know this is a huge community benefit, and it's going to benefit this organization and our physicians and the entire community for decades to come. So it is. We're looking forward to getting going. We have our certification coming up with ACGME in the month of January, and we can't wait to have residents serving here in 2017. So, Dr. Hammond, we appreciate everything you've done with that as well. Jan mentioned the demolishing of Rudder Building, and Jan, I think you may have gotten a little bit wrong. I think you said the 4th and 5th floors are coming down. There are no more 4th and 5th floors anymore. We're down to 3 and below, so it's coming down very quickly, and it's just happy to see that happening, and happy to see our new when our new rehab hospital goes up. She also reported on St. Armand's urgent care demolition. She actually showed a prettier picture than this. She showed a vacant lot. My pictures were of the actual mess that was created there. So we're excited about that. St. Armand's should be open around October 1st next year, and everything's proceeding well. So more to come. I don't know if anyone knew that Star Wars came out with their new movie this past week. But we had the Herald Trib did a Star Wars edition, and we participated along with that and put a tag on that you see on the right-hand side there. So it actually got quite a bit of. Did you see that? Did your kids see it? Yeah, okay. So it was actually fun, and we put a sign out on the main board on 41 as well that got a lot of discussion going. And then finally, do I not have? And then finally, I just want to, on the behalf of our healthcare system, want to extend a happy holidays to each and every one of you and each and every one of the members of our community. Thank you so much for your time for this past year, and we appreciate it. That's all my report, Mr. Carter.
Okay. Thank you very much, David. I don't think we have anything on the consent agenda. Public comments, Donna? No. No public comments. Legal matters, Carol Ann Kalish.
I have no report.
Yeah. Is there any other business?
Sir, yes, sir, please.
Mr. Henry.
Thank you. Thank you very much, Mr. Chairman. In our information handout, we have a flyer that says SMH to offer Dr. Dean Ornish's lifestyle medicine program to undo heart disease. We had talked about this in executive session. Apparently we didn't get through far enough. Dr. Dean Ornish's program has been researched by many significant research outfits. It comes with consequences that may not be suitable for us to offer this program. One of the big consequences of this, following this particular program, is significant neurological damage. And we need to, before we continue to say we support this, there needs to be a better review than what we've done. This is not satisfactory to me for us to be associated with this. It's very popular to say that low-fat, whole foods, plant-based diets are the benefit for everybody. That's very popular to say that today. It's not proven to be true. There's consequential neurological damage that follows strict adherence to such a routine. And I would suggest that we cause that to be fully investigated before we call this something we're offering. If we should offer it, fine. If we should not offer it, let us find that out. I do not believe at this point that it is warranted. Thank you, Mr. Chairman.
Okay, thank you, Mr. Henry.
Another comment?
Yes.
Mr. Chairman, my memory is that we discussed this quite thoroughly, and it was the cardiologists and the cardiac department that made the presentation and that said that they would like to have this be part of what it was that they did. They, of course, are going to base their treatment on each individual patient and what
Right.
they need, but that this is another possibility in an arsenal of potential treatments.
Right.
And so on that basis, I think we all felt that that was a good thing to be happening, that we were always looking for additional things in this hospital system, and that our physicians are on top of it and recommending things as they see them if they look like they might be good.
Mr. Henry, another comment?
I believe what Dr. Malone says is in fact true. We did do that. We talked about it at some length, and we did decide that offering us another opportunity to look at the problem was probably a good idea. But still, this handout, which is done under media release contacts, says SMH to offer. That means we fully endorse. Now, I don't believe we ought to fully endorse this without significant investigation. And I know the cardiologist said they'd like it, but the man's got a very popular following, but the research shows without exception that there is in fact chronic neurological damage that follows such a program.
Okay, thank you, Mr.
We should
Henry.
not be part of that.
Mr. Chairman, would
Yes,
it be
sir.
okay if I made a comment?
Go right ahead, David.
So I appreciate everyone's comments on this. Like any treatment that our service, it's not meant for every individual that is out there. Our cardiology department did endorse this and ask us to move forward with this program. But remember, you do need a physician referral in order to access the program. So I would imagine you'd have consultation with your physician, and they would determine that this would be the best course of action for whatever medical condition that you had, and would move forward. And so that's how we plan on proceeding, Mr. Carter.
Good. Thank you, David. Appreciate that. Okay, if there's no other business, I'd like to wish everyone a happy and healthy holiday, and we are adjourned. Thank you very much. It is.
Merry Christmas.
And the amount